National Malaria Elimination Program, through state government and partners, has recorded a significant reduction in malaria prevalence and under-5 mortality rate through continuous distribution and use of insecticide-treated net and SPAC to vulnerable people. Dr. Nnenna Ogbulafo stated this during the launching and flag-off of 2025 ITN to benefiting communities in the state, held at Tahi Primary Health Care, Mina. Jamilu Muhammad has more.
Speaking during the symbolic flag-off ceremony, the National Coordinator on Malaria Elimination Program, Dr. Nnenna Ogbulafo, Permanent Secretary, Minister of Secondary and Tertiary Health, Dr. Abdullahi Usman Iman, reiterated federal, state, and partners' commitment to reduce the bundle of malaria, especially in children and pregnant women, stressed the importance of insecticide-treated nets distribution of over 3 million nets targeted at 11.4 million households beneficiary to retrieve and utilize their nets for that purpose.
The integrated campaign represents a crucial milestone in the federal government of Nigeria's ongoing commitment alongside its partners to safeguard all Nigerians, especially the most vulnerable, including children under 5 years of age and pregnant women, against malaria through the use of ITN access and consistent use. Niger State has consistently shown strong leadership and unwavering commitment in this fight against malaria. Since 2009, more than 11.4 million ITNs have been distributed across the state. In 2025, we are distributing additional 3.2 million ITN to households.
The idea is to bring the burden, which technically what we call it, but the troubles of malaria, down from what it is in Niger State to a level where it does not cause problem to children who it kills or women who suffer, especially when they are pregnant. So the idea is through this we prevent malaria and prevent the troubles that occur in malaria. Now Niger State is a beneficiary, and during this time 3.2 million nets are going to be distributed, and it is also happening across the country. People that have told us who are doing research in the communities tell us that the prevalence of malaria in Niger State is very, very high. It used to be over 30%, but now it's down to 22%. So the idea is to keep it down and bring it down even lower.
Other girls and stakeholders, Chairman of Chanchaga Local Government, Dr. Mustapha Jibril, State Director of Public Health, Dr. Ibrahim Idris, all commended the contribution of the state government in safeguarding the health of the people, highlighted how these nets will save lives of families from mosquito bites.
Very happy with what I've seen. It means that the government of the former governor, Mohamed Umar Bago, is really working, especially in the health sector. He has created an enabling environment to allow for healthcare services to reach people at the most lowest level, at the rural level. The Ministry of Health, under the leadership of the Permanent Secretary, Dr. Imam, and the Director of Public Health, Dr. Idris, are also doing a very good job for His Excellency, ensuring that today that they are distributing over 3 million nets to the vulnerable, especially women and children under 5. This is an excellent thing to see, to witness it, to see it happening.
We know that malaria continues to remain a disease of public health importance, and Niger State's prevalence is at 21%. It's down from what it were in 2020. It's about 34.6%, as high as that in some, particularly in pregnant women. It contributes to high child and maternal mortality and reduce productivity in workers, particularly adults. Untreated malaria can become complicated and can also lead to death. The Niger State government is implementing strategies to reduce this burden of malaria in Niger State. We want to go to a pre-elimination state. We want to eliminate malaria in Niger State and in Nigeria.
Similarly, Agaye, Contragora, Kacha, and Bida have flagged off mass net distribution after completion of movement of ITL from local government warehouse to distribution points with key personnel at net receive caution against mutilation, sales, or mismanagement of the INT. Bida, Agaye, Contragora, and Kacha flag off and beneficiary interview.
I also wish to extend my regards to the government and rollback malaria partners for providing me insecticide-treated nets free of charge to all households in Niger State to protect us and our families from mosquito bites. Malaria affects almost all Nigerians, especially children under 5 years of age and pregnant women, and so should be taken seriously.
The net will not go around every household. I believe we understand that, but with the needs of those who have gotten it, okay, at least they will make good use of it, and then we'll try to see how to eradicate malaria from our community. That is the aim. And then those who will be getting these nets, try as much as possible not to sell them, no matter what. Make good use of these nets for your family and for the children that will benefit from these nets.
Kaku yadda wanga igiyan, kowane gidan sauro na da igiyan ga. Ku daura igiyan ga idan gidan sauron bai sauka ya rufe muku gidan gadon ku ba. Sai ku hada wanga ku daura wanga saboda ku yi tsawo ya sauka kasa ku samu lulluban jiki.
The 2025 insecticidal treated mosquito nets signify collaborative efforts to prevent the spread of malaria among families, which can lead to high-cost treatment on malaria fever in Mina. Jamilu Muhammad reporting from NSTV.